everyone, I'm Alexia, and the drug I'll be discussing is psilocybin. So what is psilocybin? They're naturally occurring hallucinogens that contain serotonin-like chemical structures. When psilocybin is taken, it's metabolized in the body to psilocin, which is a potent chemical with psychoactive properties. This means that it can affect all the senses: taste, smell, hearing, and vision. They are generally known to cause hallucinations and distort a person's sense of reality, time, thoughts, and emotions. Having said that, because of their psychoactive properties, it is often abused. Like many other hallucinogens, psilocybin causes no physical dependence, however, one may develop tolerance. Some street names include magic mushroom, mushroom, and shrooms. In terms of methods of use, generally magic mushrooms are ingested orally and is eaten fresh or dried. It can be steeped into tea, added to other foods to mask their bitter taste, and are added to fruit juice if powdered. Powdered psilocybin can also be put into capsules or tablets, and it can also be snorted or injected. A typical recreational dose is about 1 to 5 grams of dried mushrooms and about 10 times higher, which is 10 to 50 grams for fresh ones. Now, what does magic mushrooms look like? They resemble regular mushrooms in appearance, but magic mushrooms differ in that they have long, slender stems that are topped with caps that contain dark gills on the underside. Fresh mushrooms have white or whitish gray stems with light brown or white centers and dark brown edges around their caps, unlike dried mushrooms, which are often rusty brown with off-white spots. Moving on to the effects. It's important to note that there are several factors to consider, as the effects of psilocybin mushrooms may vary among different individuals. Some of those factors include the amount or dose taken, size, weight, health, their expectations, prior drug use or experience, and the environment in which psilocybin is taken. For instance, taking magic mushrooms in a calm and relaxed setting can result in a more positive experience, whereas doing so in a chaotic and noisy setting might have the opposite effect. They start to take effect in about 30 minutes and last for about 3 to 6 hours. The first 3 to 4 hours are when the effects are the strongest, as this is its peak. Particularly, the physical effects on the body include nausea, vomiting, muscle weakness, lack of coordination, high blood pressure, fast or irregular heart rate, increased body temperature, dilation of pupils, dizziness or headaches, and/or sweating, shivers, and chills. The psychological effects of psilocybin use include visual and auditory hallucinations, which is seeing or hearing things that aren't there, or claiming that they can see music or hear colors. Inability to distinguish fantasy from reality, panic reactions, psychotic-like episodes, difficulty thinking clearly, feelings of detachment from body, distortion of time and space, spiritual experiences, anxiety, and restlessness. One risk associated with psilocybin are the significant changes in body functions and impaired vision. Psilocybin resembles the effects of LSD and alters perception, motor reflexes, behavior, and the smooth muscles of the heart, lungs, and glands. Panic reactions and psychosis are another risk that may occur, typically with higher doses of psilocybin. It may also increase the risk of psychiatric illnesses and other health problems. Although psilocybin has been reported to be helpful in the treatment of depression for some people, extreme cases of psilocybin can cause mental problems. Lastly, sometimes an individual may experience a bad trip. This can consist of unpleasant or intense hallucinations, anxiety, paranoia, and/or panic or fear that they will not be able to come back from the trip, and the memory of the experience will remain with them for a while. Consequences. Flashbacks and hallucinogen persisting perception disorder are persistent visual distortions and hallucinations that affect your emotions or perceptions and can remain for weeks, months, or even years after you stop using psilocybin. These visual distortions can include color flashes and false senses of movement. Having said that, anyone can experience it, even those who use the drugs just once. Additionally, some people may develop a consistent pattern of use known as hallucinogen use disorder, which resembles addiction. Hallucinogen cravings and continuing to use the drugs even when doing so interferes with obligations at work, school, or home are only a few symptoms of this disorder. Lastly, a complete tolerance to mushrooms can be developed after just 3 or 4 days of daily use. Regular users may build tolerance on other hallucinogens that act on the same receptors, such as LSD. That is the end of my discussion on psilocybin. Thank you for listening.